When Roe was initially overturned and all of these bans started taking place, I remember talking about how scary this was because as a person who has had two ectopic pregnancies, which are non-viable pregnancies, I understood how dangerous and harmful this was going to be towards women. And I remember sharing my experience and saying that I was scared that women who had ectopic pregnancies were no longer going to be able to get the care that they needed. And so many people, mostly women, were in my DMs saying that is just not going to happen. They will always view an ectopic pregnancy as emergent and they will treat it as such. They will never turn a woman away for this. And lo and behold, they are. This article here covers women who are turned away from the ER when they are experiencing emergencies. This woman had an ectopic pregnancy that went untreated. They would not treat her until her tube ruptured and she was internally bleeding. They turned her away despite the fact she had a non-viable pregnancy until her life was at risk. And in case you don't know, because nobody teaches us anything about reproductive health or women's bodies, an ectopic pregnancy is when an embryo implants outside of the uterus, typically in the fallopian tube or on your ovaries. It will never result in a healthy baby. It is a non-viable pregnancy, and all it will do is harm the woman carrying that baby. And in my case, when I showed up at the hospital internally bleeding with a ruptured fallopian tubes, my doctors understood how incredibly important it was to treat me right then and there. There was no time to waste. I didn't even have 15 minutes before I was on a gurney being wheeled into the OR. And the fact that women are being turned away when they go to a hospital with a non-viable, life-threatening pregnancy is mind-boggling. And the thing that pisses me off the most is that so many people a year ago, 6 months ago, were saying this will never happen. Stop talking about it. That will never happen. They will never turn away a woman with an ectopic pregnancy. They know it's non-viable. They know it's life-threatening. This won't happen. But look at it's happening. It is happening all over the place, and it will continue to happen. And women will no longer just be losing their fallopian tubes or their ability to carry children in the future. They will lose their lives. They will lose their lives, and this will continue to get worse unless we change it.